The Brain in Hand system has embraced our ethos around people taking control of their own lives and their own recovery. People have used it as opposed to using other emergency services or becoming unwell.
It also brings obviously cost savings where you might be reducing the times that someone goes to a GP. You may reduce instances where people might end up in hospital in the longer term. So anything that gets in there early and supports us to do that is beneficial to all of us.
Had I been travelling without Brain in Hand, I know that I would have probably just got myself into a big stew and potentially not even been able to go back to work. Now I know that if I do come across a situation, the solutions are there for me. I don't even have to think about it. I've already thought about it. Brain in Hand was helpful in stepping down my work with Clear and moving back into going to work.
Well, since using Brain in Hand, I am able to travel on buses and go out a lot more.
There wasn't much time to do anything for myself. She's coming towards her mid-20s now. Just to feel that she can be more independent is a fantastic feeling for her and for us as well.
Hello, I'm Louise Morpeth, and I have the great pleasure of being CEO at Brain in Hand. At Brain in Hand, we support people who are autistic and have mental health difficulties. There are 700,000 autistic people in the UK, and sadly in surveys, they often report not being able to access the services or supports that they want and need. Autism costs the UK £32 billion a year. This is more than heart disease, stroke and cancer combined. These costs are not just for support and services, but also for lost income. You think about it in terms of people not being able to go to college, not to be able to get a job, not to participate in social life. If we then think about mental health difficulties, which run at around 1 in 6 in the population, the costs are enormous, over 100 billion. And this picture is made even more gloomy. A report by the Centre for Mental Health predicts another 500,000 people are likely to experience mental health difficulties as a result of the pandemic. So now, more than ever, is the time for us to have scalable digital solutions to address mental health need. Digital tools have been adopted really rapidly by the general public. If you take something like Headspace, which is a mindfulness app, it has 65 million users worldwide. I think it's fair to say that adoption of digital solutions by the public sector has moved at a glacial pace. If we think about digital solutions, they fit in 2 broad categories. The first are where the digital solution provides a new way of doing an old thing. For example, therapy, which can now be delivered online, whether that's in writing or via a video conference. The second group of digital solutions are apps, which enable the user to get involved in a form of self-help. Say, for example, something like Sleepio, which helps people to address their insomnia by using CBT techniques. At Brain in Hand, we don't really fit into either of those categories because what we're trying to do is to combine in-person support with a digital solution. So what is Brain in Hand? Well, first of all, our aim is to help people live more independently. So this is typically people who have difficulty coping with unexpected events, struggles to manage their anxiety, and find it difficult to make decisions. So we're not condition specific, but this is quite often people who are autistic, who have ADHD, or have an anxiety-based mental health condition. So our solution has 3 components. First, personal planning sessions to onboard new users onto the software. These sessions start by helping the user identify goals that they want to achieve that will take them towards independence. We work with them to identify their strengths, to then think about the difficulties they're experiencing and break these down into problems and solutions. These are all then ready to be added into their Brain in Hand, which is accessed via a website. So the website enables the user to build up their library of problems and solutions, to create routines for the day, to create reminders, so that they have a whole set of materials that are available to them through their mobile as they're out and about. Within the mobile application, there's also a mood monitor. The user's prompted to think about how they're feeling, and if they're feeling great, then they press green. If they're feeling a little bit off, they press amber. If they need some extra help, they press red. And this will connect them to our round-the-clock response service. So this is a non-medical response service available 24/7, and the aim is simply to get the user back on track. So they might be, depending on what their preference is, they might be contacted by phone, by email, by text message, and the responder can help them to either remind them of the strategies that they have, to help them create a new strategy to deal with a particular problem that they're having, or simply just to calm them so they can get their day back on track. Brain in Hand is really suitable for anyone who can place an order on Amazon. They have reasonable level of comfort with technology, but by no means be a tech whiz. You need a basic level of literacy and also a motivation to want to make a change, to have a goal that they want to work towards. Brain in Hand is a mature solution. We're approved by the Department for Education to support university students who have a disabled students allowance. We're approved by the Department for Work and Pensions for people who are in receipt of access to work. We have students using Brain in Hand in more than 80% of universities across the UK. In addition, we have contracts with 20% of English local authorities and actually up to 45% of local authorities in London. We've so far supported over 6,500 users. Prior to the pandemic, we onboarded our new users by delivering in-person sessions, typically 2-hour sessions at a location that was suitable for them. Since the pandemic, we've pivoted our model and we deliver it virtually using video conferencing. This has a great advantage of being much more flexible, and it means that we can deliver sessions at a length and at a frequency that really suits our users. We really didn't know how well this would be received, and I'm glad to say that we have Thomas and Michelle available to tell you about their experiences. In the next slide, you'll see a film clip of a user and one of our specialists.
How does it feel? I mean, we've been working together for a few weeks now. How does it feel to receive support digitally rather than face to face?
It's very hard to look at someone in the eyes face to face, but when you're looking at a computer screen, it's a total different kettle of fish.
Brilliant. Okay. And does it help you with your anxiety at all, mental health?
Yeah, I find it does, and the way that the traffic light system, the way that works, it's really good. It asks you how's your day going, but I find mostly because I'm pressing the green button because I'm not having them anxieties or them problems because I've put them into the diary. So if I did have a problem, I could go to the app and it could solve things. If something happens, the solutions and that.
Anything else you can think of?
No. I just think the app's superb and it really does help people like myself.
Oh, that's fantastic. Thanks so much, Thomas. It's been really good talking to you. Thanks for doing this.
Yeah.
So you heard there from Thomas and Michelle giving an account of what it's like to do an online setup. Prior to the pandemic, we did very few online setups because we assumed that users really wouldn't want that. However, we were completely wrong. We've interviewed and observed 27 users who've all been set up online, and we found out that it's an overwhelmingly positive experience. Not only do users state that they prefer this way of receiving their onboarding, but that it has many additional bonuses. For example, users can take a break when they want. They feel more comfortable because they're doing the setup in their own home and not in unfamiliar surroundings. They can actually have more control over when sessions happen and how frequent they are and how long they last for. And particularly for autistic users, the eye contact that's required in an in-person session isn't necessary on a virtual call. So there have been many unexpected benefits from pivoting from an in-person model to a virtual model. And it's a really salient, strong reminder that if we ask our users what they think about things, that we can learn so much about how to improve Brain in Hand and what we do. Of course, an online setup is not going to be okay for everybody. Some people would prefer either to do a session in person, or we might need to be more creative, for example, support over the phone and have someone else involved. But we want to be really forensic and make no assumptions about who this will work for and under what circumstances. And so over the next few months, we'll be really trying to understand the limitations of delivering our online setups. So what does the future hold? Well, the virtual onboarding seems to have limitless possibilities, and we think that it will impact usage and impact and potentially long-term usage. So with us being able to adjust the frequency of sessions and the timing of sessions, we really think that's going to deliver great benefits for the users. At every step of the way, we'll be involving users in the design process and learning from them about what does and doesn't work. And we'll be taking the same approach to developing content that can be preloaded into Brain in Hand to help give people a bit of a jump start when they're having their first session and thinking about solutions that might work for them. But one thing's clear, it's been a very sobering lesson for us in the pandemic that we really have to involve users at every step of the way, because by listening and taking on board what they say, we will make a much better product.